Hi guys, good morning. Welcome to the AMA session. I'm Dr. Ben Benham. I'm one of the co-founders of Happy Ed. Here we go. We got a lot of questions. I love it. So one of the first questions to start out with is basically, are there different treatment options depending upon where on the scalp I'm thinning? So that's just kind of like a yes and no. I think traditionally on the Rogaine bottles that were marketed everywhere, it had said that you can only use the Rogaine on the crown area. So a lot of people thought that Rogaine only works in the crown area. The truth matter is that that's actually not really true. Uh, the only reason why it said that in the bottle was because when Rogaine, the company Origin, did the clinical studies, they only used it on the crown. So their FDA approval was only on the crown. So they couldn't really speak basically off of what the FDA approved it. Now, I don't work for the FDA. We're doctors. We could really basically talk anything about anything and how we feel comfortable by using it. So the truth matter is that you could use Rogaine or any other minoxidil products really everywhere on the forehead, everywhere on the scalp, frontal, mid, and crown. And as long as you have some hairs there, it should really work. So, question: should I use the roller prior to every application on Happy Head? Um, so the question is, when should you use the roller? Before applying or after applying it? Honestly, there's no really good answer, bad answer. We now recommend to apply the topical first and then basically derma roll on afterwards. And I think that's going to allow product to penetrate in deeper and get better results. Also, uh, the patient here is saying that they use a roll that's a little stronger than the one that we brought through Happy Head, which is fine as well. As long as you're not making your scalp bleed, basically, I'm fine with it. Thank you for that question. Was thinking of using the minoxidil finasteride gel together. Does it mean that if I stop using minoxidil, I'll have more hair fall? So, so if you're already using minoxidil and you transition over to the Happy Head finasteride minoxidil combination, usually over 95% of the time, you should not have any hair loss. Now, there are some rare exceptions. For some reason, people that does happen, which we don't really understand why. But usually, you shouldn't have much hair loss because you've already been using um, the minoxidil. I'm a 75-year-old female and just ordered the oral minoxidil. I heard about it from a dermatologist program on Serum XM Doctor Radio. Just wondering if I should be using a topical as well. Well, that's good. Maybe I should get on that Sirius XM radio program. But anyways, so in my own personal practice, uh, and also on Happy as well, but we've noticed that when patients use the oral minoxidil along with topical minoxidil, they actually do much better. So my recommendation would be to use both. Now, I would not use both simultaneously. I would probably start with one, most probably do the topical for several weeks and let your body get acclimated to it, and then basically add the oral minoxidil to the regimen. The recent Happy End newsletter had an article on topical caffeine for hair loss. The article said that in one study, the caffeine was equivalent to topical minoxidil. Can you comment on topical caffeine? And is it used for male pattern baldness? Do you offer it right now? So that's a very good question. Great question. So if you actually look at the clinical study, so the topical caffeine was equivalent to topical minoxidil 2.5%. 2.5%, not the minoxidil 8%. So in essence, basically, the studies have shown that rosemary oil, along with caffeine, have equivalent efficacy to minoxidil topical 2.5%. Now, the question is, how good is minoxidil 2.5%? If you look at the clinical studies on minoxidil 2.5%, it's not really good at all. So that's why the minoxidil 5% is really, really much superior. In fact, I tell my patients who are using the female Rogaine, the 2.5%, the 2% female Rogaine, that basically they're just wasting their time. So the caffeine does help a little bit, but not much. So there are some. I think our shampoo does have caffeine in it. So we really have not added it yet to our topical Happy Head formula. I mean, we just don't feel it's very strong enough. But there's some shampoos that have it, so you could get it, through other mediums. Never use any treatments. Age 67, hair thinning throughout, good health. Survived cancer 10 years ago. Um, Minimum is daily. Will this treatment show results? So here's the thing. So first of all, you can always send your photos. I could take a look at it. It all depends on how bald or thin you are. So if you are bald, it will not work. If you are thin, which means that you look at the scalp and the hair is there, but it's just thin, then it's gonna work. So again, you could send us a photo to help a happy head, and I'll be more than happy to evaluate the photo and basically give you my opinion. Is the concentration of the dutasteride lower in the kitchen sink product versus the one I ordered topical? If so, why is that? Also, what is the concentration that's used? I think on the regular topical dutasteride, that's just the regular one on its own, that's mixed with minoxidil, is dutasteride 0.25 with minoxidil 8%. In the kitchen sink, since we're combining the dutasteride and finasteride together, both of the concentrations 0.1. The reason why we made that because we didn't want to overdo each one of the products. We just didn't want to, just overload your system with each one of the products. That's really the reason why, and we want to keep, we just want to minimize the side effects. In second month of use, I'm going through the prescription fasting I prescribed due to my situation. Uh, so enough hair in some areas which absorb the product, thus I use more. So we have enough hair in one area, so it absorbs more compared to other areas. Can a larger size bottle with more liquid be done? I also want to commend you. In the past year, I have seen at least 2 dozen marketers selling their hair growth products on Facebook. Nobody does it with these Q&A segments, nor do they provide the customer assistance. Kudos to you, sir. But thank you so much. Really appreciate it. I mean, first of all, we truly believe that we are we're a prescription grade product. So, and we were backed by clinical studies. And we believe in what we sell and we believe in our brand. I mean, we do this every day in our clinic. So we see the clinic and the results. So let's go back to that. So unfortunately, the 60 ml bottle is the largest size we have, but you could order more. I mean, you could order one time, just order the 3 pack as have some extra ones so you don't run over. You could also tell the help desk to maybe like every other month order you 2 bottles. So this way you're not running out of product. Why don't you email the help desk at help@happyhead and say, look, I want to have extra bottles on hand so I don't run out. So and they will come up with a program. Again, just say I want an extra bottle every other month. So and they will help you with that. Well, we're here to help, guys. This is all we do here. Um, I am 75 and just ordered the oral minoxidil. What can I use for customized topical formula? So what I would do, since you're already ordering the oral minoxidil, I will also use the regular standard topical one. I mean, as long as you don't mind the finasteride, I will order the standard one, which has finasteride with minoxidil in it. You will see better results. My only recommendation is do not do both at the same time. That means do not start the topical minoxidil or oral simultaneously. Do the topical first, oral first for a couple weeks, and then add the other one. Hi, I'm kind of sick right now. Before the urgent care told me, I have upper respiratory cold. I was wondering if, because of my dermatitis condition on my scalp, and I've been itching and scratching somewhat, that might have caused the solution to get into my system somehow and cause an infection. I'm coughing really bad and I'm sneezing. I've never caught a cold this bad. Just your take. So yeah, so no, no, I don't think the topical will cause you basically to get more sick. Can't talk like coughing. I think everyone's busy. There's a cold and flu, and everyone is getting upper respiratory infections, basically as we speak. So I think you just have an upper respiratory cold that has nothing to do with happy yet. Sorry to hear that, and I hope you get better. Um, Hello, I'm a huge fan of Happy, and I really appreciate the office hours. See you on Tuesday. Well, thank you so much. Thank you for joining us. Are there any holiday specials with discounts on purchasing Happy Head solution? I think for new customers, there were holiday specials, um, but I'm not sure if it's for returning customers. I'm gonna have Evelyn basically put in the chat right now. How far can I go in needle size with dermal roller on my scalp, and how often should I use it? Also, how much time should I spend on microneedling per session? Great question. So if you look at the internet, people are saying do the 1.5 dermal roller and really getting there. I disagree. I think using a lower depth, using the dermal roller that's 0.25, and gently roll on the scalp just for like a minute or a minute and a half is all you need. So 0.25 a minute, but do it every night. That's the key. See, when you use a larger depth, you cannot do it every night. Typically people recommend doing it like every other weekend. But if you do the dermal roller at a lower depth and you could do it every night, I think you're gonna see better results. So the 0.25 depth, apply happy on top, gently roll, basically back and forth. We also provide the dermal roller for free. Don't we give it out for free, Emma? We won't? We used to. We had a promotion that we used to give it for free. Okay, but not anymore. But you could get a 0.25, or if you really want to be aggressive, do the 0.5. Remember, don't press too hard, don't be too aggressive, and don't make yourself bleed. What are different causes of hair loss? So that's a really good question. So there are many different causes. So we know that testosterone basically is one of the main causes. Testosterone gets converted to DHT. DHT binds to hair follicles and miniaturizes the hair follicles, causing the hair basically to shrink and get smaller. Also, lack of blood flow to the scalp could cause hair loss as well. And the reason because one, if there was no blood flow to the scalp, basically, you're not getting enough nutrients. Number two, lack of oxygen in the scalp, it inversely causes DHT production, concentration to go up. So by having more blood flow to the scalp, you reduce the DHT, you wash it away, you introduce more oxygen. And then other causes of hair loss, I mean, it could be genetics, it could be stress level will cause it, lack of vitamin D, lack of biotin, abnormal thyroid levels, lack of iron in females. If you are eating a lot of whey protein isolates, which basically will inversely increase your testosterone level, that's going to cause it. Taking creatine will cause hair loss. So there are a lot of different reasons why people will lose their hair. I am sitting at the crown area. I'm 57. Have hair a small afro while using Happy End. Can I use anything else on my hair, like rosemary oil, castor oil, like natural stuff? Yes. So again, let's go to that rosemary oil question. So according to clinical study, we actually looked it up last week. The rosemary oil is only as good as minoxidil 2.5%. Yeah, it's better than a placebo, but it's really not that great. So if you're using Happy End and you really want to see better results, my recommendation is probably to go on also on oral minoxidil. We do sell oral minoxidil as well. Oral minoxidil blood pressure medication, and if you use topical oral minoxidil, topical Happy End with oral minoxidil, you will see better results. Now, there's nothing wrong with using rosemary oil. Again, it's not going to hurt you, but I'm not sure how much it's going to help you really. What's best to give Happy End since it requires a consultation? That's a really good question. Um,
We have our holiday pack available, so it would include shampoo, conditioner, supplements, and $50 off a subscription. So it would be
oh,
for new customers, but if they're interested in giving it as a gift.
yeah, so yeah, you could give like a lot of our non-prescription ones as a gift, like the shampoo and our multivitamin is really great. The multivitamin, the shampoo, and you could basically get all that. And we have a pack. Yeah, that's our holiday pack. One shampoo, one conditioner, one supplement. Also, we know we should also probably think of just having like a patients could buy like a gift card, like an initial office visit, like 1 month free gift card.
Yeah.
Thank you. We'll talk with the board about that. But as of right now, it's just a holiday pack. Thank you for that question. Can I use your therapy and inject it with a laser helmet? Yes, of course. There's no problem. Do you have a brand that you find most therapeutic, and how effective is the combination? So it's funny. I was just talking about with a patient this morning. Um, the laser hats, in my opinion, are about 50-50. I think they do work in some patients, but they don't work in everyone. You could definitely use it in the combination. We really don't have any preference, basically, at the moment. There are a lot of them out there, so we're not really connected to any of them. I've been using Happy product for 3 months. How do I know if it's effective on my thinning hair? Take monthly photos because you are going to forget how you look. So take a photo month one, month two, month three. Don't take a photo every day. Just on your monthly anniversary, just take a photo and basically and then once you get to 6 months, go ahead and compare the photos from 6 months to month one. I will tell you one thing from my personal experience of being in clinical practice for more than 15 years. Patients, and this is normal, forget how they look. And that's the truth. I have patients that literally come back and they have so much thicker hair and they tell me they have not noticed an improvement. Why is that? It's because we look ourselves every day and we don't see the day-to-day changes. It's called the pregnancy paradox. If your wife is pregnant, you don't see the day-to-day changes are getting bigger. But when you compare photos, and I say, oh my God, what a difference. So in my personal practice, whenever we start patient on a happy head or any other prescription medications, we actually take a baseline photo and I have them come back in 6 months. And I will take the same photo, same image, same directions, angles again, and compare the two. And patients are usually surprised with how much growth they get. So again, I will encourage you to do the same thing. Take photos the same way and basically compare. So how long should I stop using topical finasteride before trying to get pregnant? Look, if you are actively trying to get pregnant now, you should stop right now. So as whenever you start actively trying, please stop the topical finasteride. My recommendation is at that point you should either switch over to oral finasteride or oral minoxidil to maintain the results. What's the shelf life of the topical finasteride? I have noticed it turns yellow after a period of time. Does that indicate it's less effective? No, it does not. So what happens is that um, there are there are many ingredients in the happy head. One of them, is finasteride and minoxidil. Those two don't have any colors to them. The ones that have colors is the retinoic acid, and also we had aloe vera. So when you let it sit basically for a while on the shelf, the aloe vera drops more out of the solution. None of the other ingredients. It's just the aloe vera that gets darker. So it doesn't really mean anything. It's just the aloe vera that's just getting darker. Uh, so typically, I think the shelf life. I mean, you have to. I mean, honestly, you could use it.
6 months or so, it should be on the.
Yeah, it should be on the bottle was about 6 months. Now, unless you're doing the water-based formula, which is a 1 month shelf life, but you could use it beyond the shelf life. Hair supplements. What are the benefits? And do I see better results or faster results? So we know for sure that vitamins are necessary for good hair growth, which means I have patients that come in and they don't have, like, they have very low vitamin D and they have very low iron. And in those cases, no matter what you do, you're not going to see the best results. It's like, for example, trying to drive a car that has no gas. The car is there, but you can't drive because there's no gas. So you do need sometimes those vitamins basically for better results. And the ones we recommend is like biotin, vitamin D, collagen, keratin. Those are the ones. And our happiest supplements basically has all those vitamins. How often should I use the happiest shampoo and conditioner? Look, you could use it anywhere from a daily to like every other day for best results. Does medical therapy in combination with laser therapy is more effective? If so, what laser helmet do you recommend? So again, I don't have any brands that I recommend. I do always believe that combination therapy does work better. I don't really think those laser therapies alone by themselves work, but if you combine it with Happy End, they're probably going to work better. And in my opinion, it's about 50-50 that the laser therapy will work. What is the kitchen sink formula? So the kitchen sink is a combination of two different testosterone blockers. It's finasteride, which inhibits the 5-alpha reductase 1, and dutasteride, which inhibits the 5-alpha reductase 1 and 2. Now you're going to say, well, if dutasteride inhibits both enzymes, what is the point of having finasteride in there? It's a great question. The reason is because in clinical studies of oral dutasteride, patients overall did do better on oral dutasteride. No question about it. But there is a but. There are some patients that in clinical practice do not respond to dutasteride. We don't understand why that is. I mean, if you're inhibiting both enzymes, why don't you respond? We don't know. So, and we have some patients that go on dutasteride and then go back on finasteride, and they swear that finasteride work better. So in the kitchen sink, basically, we're trying to cover all of our bases. We have the dutasteride in there, the finasteride in there, and that's what the kitchen sink is. I just started using the minoxidil foam. I ordered a super capsule. Should I stop using the foam? No, do not stop the foam. The reason is because when you apply something topical on your head and take it orally, you call sandwiching. You will end up with better results. So good luck with the super capsule. You're gonna love it. What's the difference between oral finasteride and oral dutasteride? Difference is that oral finasteride inhibits only one enzyme, what's called the 5-alpha reductase 1, and oral dutasteride inhibits two enzymes, 5-alpha reductase 1 and 5-alpha reductase 2. That's the difference. Again, majority of patients do respond better to oral dutasteride, but there's some patients that do not. What is the concentration of finasteride in your finasteride minoxidil combination? Finasteride is a 0.25, but it's customizable, which means if you need to take it down, you could take it down to 0.1 or other concentrations depending upon your chemistry and your need. But I think right now also we're shipping out the zero point 0.3. I think the zero point 0.3 is also available, which goes through our other pharmacy in Philadelphia. Do any topical peptides help with hair growth? That's a good question. I mean, that's always been a debate. We do believe that topical peptides do help with hair growth, and honestly, this is why our shampoo has a lot of peptides and growth factors and collagen and keratins in it. Can you discuss the potency of the super capsule compared to the oral and topical? So the topical happy hit combines three different ingredients: is minoxidil, finasteride, and retinoic acid. The oral super capsule contains oral finasteride and oral minoxidil. So you have both in an oral version, and also vitamin D is added to it because a lot of guys are actually deficient in vitamin D. So it's just much more superior to taking each of those drugs individually. And in our clinical practice here in Los Angeles, California, we see that a lot of patients, the trend has become to go on topical minoxidil and finasteride happy end, and to take oral finasteride and oral minoxidil. And that has become a trend, and those patients do really well. Why can't I take finasteride as a 75-year-old? You could. I mean, you could definitely take finasteride. There's nothing wrong with it. Finasteride is actually a prostate medication, so you could take it. I do recommend probably you may want to do a PSA test before you get started, but you could take finasteride as a 75-year-old. Is Happy Head also for females? Yes, we have Happy Head versions for females. So if you're a female above 50, you could do the topical finasteride and minoxidil. If you're a female below 50, you could do the topical spironolactone with minoxidil or topical minoxidil alone by itself. Can I get the kitchen sink formula with the 0.25% dutasteride and 0.25 finasteride? Or is that too much? I don't think we have that formula. We don't have that formula because we don't want to overload your system with so much anti testosterone, basically testosterone blockers. So the kitchen sink formula only comes with the zero point 0.1 finasteride and zero point 0.1 dutasteride. We do not have the 0.25 finasteride and dutasteride in the kitchen sink. Sorry, great question, but we don't have them right now.
If you're on the kitchen sink and you don't notice like improvement, how would you know like if you need to add more, or what would you do if that's not?
Well, if you're on the kitchen sink and you're not seeing improvements after 6 months, why don't you send us a message and we could probably talk about that a little more in detail. You could set up an appointment with my Calendly. I'm more than happy to get to you. I think at that point, honestly, it's probably better to go on like if you're on the kitchen sink, just add the super capsule to the regimen. What's the benefit of spironolactone over finasteride? So there's just different medications. Finasteride is a testosterone blocker, which means it's a DHT blocker, which prevents your testosterone from converting into DHT. And spironolactone is also a testosterone blocker, but it doesn't block the conversion of DHT. It blocks the testosterone from binding to the receptor. Spironolactone is typically mainly used for females, whereas finasteride is mainly used for males or females above 50. How often should a derma roller be used after each twice the application? So no, actually we recommend doing derma roller once a day. So basically you want to do it after one application. So you put it on literally for 1 minute, gently derma roll. Remember, don't apply too much pressure. Don't make yourself bleed, and don't use in ones that are too deep. Can I start the kitchen sink, or is it too high risk of side effects? So look, if you've never done anything, I would probably not start with the kitchen sink. I would probably order a regular standard formula finasteride and see how you do. I would probably do that 4 to 6 months before switching over to the kitchen sink. Look, our goal at Happy at the end of the day is to, make sure that our patients do not have side effects. I mean, look, we have thousands, and thousands and thousands of patients on it. So, and we'd love for you guys to see results, but one, it is not a race, and two, your safety is number one for us. So our recommendation is start something simple, standard formula, and after a few months, if it's not working, we could always basically up that to the kitchen sink. Also, if there's any questions, you can also make an appointment with me at my office hours. Just email help at Happyhead, and we'll be more than happy to coordinate those schedules. Um, what's the difference between finasteride and dutasteride? So the finasteride inhibits one enzyme, which is a 5-alpha reductase 1. Dutasteride inhibits two enzymes, 5-alpha reductase 1 and 2. In clinical studies of oral dutasteride versus oral finasteride, dutasteride was superior to finasteride. However, there are some patients that, although dutasteride is a superior drug, they just may not necessarily respond. And also, if you look at traditionally finasteride always came first. So, and most patients respond really well to that, to finasteride. So we typically like to reserve dutasteride as like the secondary backup option. So the standard formula of Happyhead is topical finasteride mixed with minoxidil 8%, mixed with retinoic acid, mixed with hydrocortisone. Well, guys, thank you so much for joining us on another Happy Head AMA. I want to thank Evelyn, basically, for putting everything together, and Eric, who are VP of Operation, who's somewhere, and also Jordan, who's somewhere as well, all monitoring. Again, I really appreciate your questions. We really enjoy coming every week, basically, to answer all these questions. You could actually find a copy of like a lot of these podcasts somewhere on our website. So you could, and YouTube, actually, you could go on the Happy at YouTube as well, and we have all of our podcasts. Also, please take a minute and write us a review on Trustpilot or Facebook. We really appreciate your help. Again, if there's any questions, feel free to email us at help@happyhead.com, and we'll get back to you right away. Have a beautiful holiday season. We're going to see you guys next Tuesday. Have a nice day.